heroin, crack, opium, methamphetamines, cocaine, LSD, and marijuana. What's the difference between these recreational drugs? Out of the drugs listed, marijuana is the only drug that is not chemically man-made or altered, but is grown as any other crop is. Marijuana is also the only drug that has medical benefits, and has been proven that marijuana is less addictive than alcohol, nicotine, and even caffeine. There are many reasons for legalizing the recreational and medical use of marijuana, but I would like to talk about 3 of them. They are that legalizing the drug will benefit those in need of natural relief in pain, legalizing it will reduce the smuggling burden and teenage risks, all the while benefiting the economy by taxing and regulating it, as well as releasing the 20 million Americans who are generally law-abiding, tax-paying, and giving individuals to their communities from the burden of being a criminal. The usage of marijuana benefits those who seek a natural solution to easing their pain. Those who suffer pain such as nausea, vomiting, lack of appetite, from illnesses such as multiple sclerosis, cancer, and AIDS, and other diseases and illnesses have been prescribed many different types of drugs to help with their symptoms. However, with most of these drugs come serious side effects such as nausea, constipation, dizziness, weakness, weight loss, and other side effects that are the very symptoms of the disease. Why would anyone want to do that? The side effects of marijuana are much less harmful and painful to the body, as well as actually reduce the amount of pain the customer feels, the nausea, the weight loss the patient is enduring. Also, most of the medications available to the patients are in pill form, which has already been proven repeatedly to cause damage to the liver. As stated by Jocelyn Elders, MD, the evidence is overwhelming that marijuana can relieve certain types of pains, nausea, vomiting, and other symptoms by such illnesses as multiple sclerosis, cancer, and AIDS, or by the harsh drugs sometimes used to treat them. And it can do so remarkably safely. Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day. The bottom line is that medical marijuana use is always informed consent by the patient and the doctor, in which individuals and their doctors have decided that the benefits outweigh the risks, especially when it legally eliminates the biggest risk, getting caught. Legalizing it will reduce the smuggling burden on the country and teenage risks, all while benefiting the economy by taxing and regulating it. Similar to the lift of prohibition of alcohol, there will be a significant reduction of smuggling the illegal drug due to the fact that it will then be a government-regulated good, such as alcohol or tobacco. By doing so, this will put drug dealers out of business, thus terminating the sale to anyone who tries to buy it, such as children and teenagers. Most of the agencies that are fighting for the legalization of marijuana agree that marijuana is not for children. iReport.com expresses that, nonetheless, adults have demonstrated over the last several decades that marijuana can be used moderately without harmful impacts on the individual and society. This is similar to the fact that teenagers can't walk into a liquor store and purchase a handle of vodka. There are age limits set, warnings on the label, and people regulating their usage. Marijuana can alter one's perception, so driving or operating heavy machinery should be against the law. But that does not mean that one shouldn't be able to enjoy marijuana in the safety and privacy of one's own home. This would also reduce the exposure to other, more illicit drugs, considering that most drug dealers want to introduce people to more addicting drugs to help boost their sales and keep them coming back for more. Again, similar to alcohol and tobacco, there are risks, but it is an American's right to choose whether he or she wants to partake or not. Marijuana should be a choice and a right we all have as well. This will also reduce the risk of purchasing fake products, which eliminates risks of accidentally consuming much more harmful drugs. The government will also be able to regulate and tax the product as any other good, thus bringing in another form of income that could be given to education programs or rebuilding communities. We spend somewhere around $300 million to fight marijuana annually. By legalizing it and taxing the product a federal excise tax of 6% on the $11 billion that consumers spend on marijuana every year, that's currently going to drug dealers on the streets, by the way, would then produce $660 million for the federal government. By legalizing marijuana, it would relieve the 20 million Americans who are generally law-abiding, tax-paying, and giving individuals from the burden and risk of being a criminal. A lot of people say that we should not legalize marijuana because it is addictive. Though there have been addictive qualities connected with marijuana usage, it is ranked less addictive than alcohol, tobacco, and caffeine. So, if they're worried about people getting addicted, then they should be turning to Starbucks for addicting people to caffeine. Some people would prefer to relax after work and enjoy a beer. Some people smoke cigarettes throughout the day to ease them of their stresses. Why should it be any different if someone wants to smoke a joint from a stressful day? In the hands of responsible adults, marijuana is a way to unwind, relax, or enjoy an evening with their friends. Most of these people have no problem getting up, going to work, providing for their families, and paying their bills. Even so, in the hands of irresponsible teenagers, marijuana is safer than consuming loads of alcohol, and which could possibly put them in the hospital for alcohol poisoning and potentially claim their lives. It has even been proved that driving high is safer than driving drunk, although both are still obviously very dangerous. For all of those reasons and more, I feel that the most harmful aspect of marijuana is the out of proportion and misinformed view many have on this substance, not the actual effects of marijuana itself. Marijuana can be and has been used responsibly by adults. Whether all Americans are ready to admit it or not, prohibition of marijuana has failed. For 75 years now, the United States has tried to diminish the usage of marijuana, but has only resulted in ticketing, jailing, and punishing millions of hard-working, successful Americans for a crime that shouldn't even be considered a crime. Change is hard to come by, but cannabis is one of the top cash crops in the world, and the United States should welcome this change and jump on board and take advantage of this wonderful, prosperous crop.